ZAMFARA state government has officially flagged off commencement of access to free healthcare services to 34,000 less privileged and vulnerable persons across the 147 wards in the state. The governor, Bello Mohammed, who inaugurated the program at Talata Mafara local government of the state, said it is part of his administration's determination to provide quality and access to healthcare services for all categories of residents of the state. The report.
Accessing healthcare services is a big deal to residents of Zamfara State, northwest Nigeria, especially those in rural communities. This is due to the security challenges currently confronting the state, where many rural communities have been sacked. The flag-off of the free healthcare services to 34,000 pregnant women, children under the age of 5, and victims of banditry activities will bring huge relief to the beneficiaries. The state's Deputy Governor, Hassan Nasiha, who represented Governor Bello Mohammed at the event, said the state government had approved 1% to the State Contributory Healthcare Management Agency as equity fund for the vulnerable groups and matching grant for the Basic Healthcare Provision Fund, BHCPF, in order to strengthen the state healthcare system in the state.
As we are all aware, ladies and gentlemen, access to affordable healthcare continues to be a challenge for most households due to high level of poverty and significant reliance on out-of-pocket expenditure. Hence, health insurance population coverage throughout the country has remained low. This challenge forced most states of the Federation to domesticate the NHIS based on their religion and traditional value system and other peculiarities.
The State Commissioner for Health, Aliu Abubakar, said the present administration will not relent in its effort until residents of the state enjoy access to quality health services.
The Basic Healthcare Provision Funds was established under Section 11 of the National Health Act as the principal funding vehicle for the basic minimum package of healthcare, and at the same time serving to increase the physical space and overall financing to the health sector.
The Executive Secretary, Zamfara State Contributory Healthcare Management Agency, Dr. Abdul Qadir Shinkafi, disclosed that the program is to cater for the vulnerable population, which includes pregnant women, children under the age of 5, the aged, people living with disability, and internally displaced persons in 147 wards in the state.
Your Excellency, today's occasion marks another milestone in the state health sector reforms where vulnerable populations across the state have access to affordable and qualitative healthcare services owing to your total commitment, interest, continuous support to the agency since its establishment. These beneficiaries will access healthcare in the NHIS accredited healthcare facilities ranging from comprehensive health centers, primary health centers, and general hospitals to provide primary and secondary services across the state.
Some beneficiaries of the health intervention appreciated the Zamfara State government's desire to provide free healthcare services in order to improve their well-being.